are listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. Today I'm going to talk about drug intolerances that involve your skin. There's 3 different ones. One is like itching, kind of a typical rash kind of reaction. And rashes are a big culprit of allergies, and they're a big sign of allergies. But there are some medications that lead to a skin reaction or a rash type of reaction that is not allergy related. It's just a typical side effect of that medication. Another side effect of medication that people can be intolerant to is flushing, which is that redness or hotness that comes on the skin. And then the third one has to do with dryness. And so some people experience dry skin just all the time, and that's just a nature of skin in general. But also there's medications that can cause any places in your body that's supposed to remain wet. So like your eyes are supposed to stay wet so they stay comfortable and can focus, your mouth, things like that. So anything that can cause dryness and parts of your body may not necessarily be related to an allergy or anything, but it's like a side effect of the medication. And intolerance just means that you can't handle it. In medicine, I would never ask anybody to tolerate something that makes you really uncomfortable. But knowing the difference between what is a side effect of a medication that you may be intolerant to versus saying that you're truly allergic to it, knowing the difference between those two mean that you can communicate better with your healthcare professionals, and also knowing if that intolerance is going to be like long term or if it's just like the small little hurdle you got to get over when you first start taking a medication. Because sometimes, like I talked about on Monday, with some of the digestive tract side effects, people are like, oh, I can't take this, it makes me nauseous. It's like, well, if you can make it the 2 weeks that it makes you feel that way, the rest of the time on the medication, especially if it's something that you have to take for the rest of your life, if you can get over that hump of it making you feel kind of crummy, then you're not going to notice it after the fact, and then you're going to reap all the benefits of those medications. So let's start with the first one that I mentioned, which is like an itchy rash. Narcotics are a huge proponent of causing itchy rashes. And there are some people who are highly allergic to narcotics that go into highly allergic means like borderline anaphylaxis, lots of swelling, difficulty breathing, all kinds of crazy stuff. Narcotics sometimes make people nauseous, and they can be intolerant to that. It makes them feel so bad that they would prefer to be in pain versus like experiencing the nausea. But in hospitals, a lot of times pain medications are injectable, and that's just kind of the nature of that beast. And if someone comes down with an itchy reaction due to a pain medication, then rather than stopping the pain medication and trying to get them something else, if that's the only problem they're having with that medication, they will give a dose of Benadryl along with that pain medication. There's people who are on chronic pain meds for chronic conditions. Either they're trying to avoid surgery, or it's something that the doctor says your body is never going to ignore this pain, so you have to be on pain medication long term. And that itching is something that they may deal with on a regular basis. And so rather than trying to swap around all these pain meds, the easy fix for that reaction is an antihistamine, which is usually Benadryl. Usually we don't recommend taking medications to fix a side effect of another medication. But again, if it's something that if you can kind of get over that hurdle and get past it, then you're going to reap more benefit of that medication versus stopping it and restarting with something new. Other medications that cause skin reactions are, there's some antibiotics that can cause a skin reaction. Sulfa medications, so like the antibiotic Bactrim or Septra, those are the brand names. They're 2 brand names, but they're the same generic, that just companies kind of monopolized on that at the same time. And they're like, we don't know who wins, so everybody gets a trophy. Generic Bactrim or generic Septra has a very common side effect that if you take it and then you're out in the sun and get a lot of UV exposure, then your skin can actually become hypersensitive to that sunlight and become red and swollen. So it's not just like a sunburn, but it's actually like a reaction that goes on in the skin that causes all of these chemicals to be released and leads to swollen skin. That is usually, sometimes people take it and they don't notice it when they go out in the sun. Other times, especially if you're really fair-skinned, it can be a really serious problem and it can be really painful. It's a skin reaction, but it's not an allergic reaction. It's just a typical side effect of that medication that you have to avoid. Another medication, another group of medications that can lead to that kind of skin reaction from the sunlight are the tetracyclines. So like tetracycline, minocycline, doxycycline. Those medications can also cause that skin reaction in the sunlight. So you either have to avoid it, or if it happens to you, then you usually have to take some kind of anti-inflammatory or pain reliever to get comfortable again, because it's not sunburn. It's actually a chemical reaction in your skin that leaves your skin swollen and painful. So then the second one I mentioned is flushing. So when your skin turns red and you feel hot, there is a B vitamin that is used to help with cholesterol reduction, and that's called niacin. So niacin can lead to flushing. There are slow release niacins that you can use. They release slower in your body, so you don't get that dump and that rush of that medication all at one time to prevent the flushing. But again, that redness and that feeling of your skin is not an allergy to that medication. It's just a typical side effect to that medication. And to help people tolerate it better, the recommendation is to actually take a baby aspirin 30 minutes before you take the niacin. The aspirin kind of thins the blood a little bit, works in the blood vessels, so then when the niacin hits it, there's just not all of this blood all at one time to like rush out to your skin to lead to the redness and that hot feeling. Hormones can lead to flushing. If anybody is of that age to experience like menopause and you've dealt with hormone changes and you get the hot flashes, that's usually a hormone problem. If you've ever been pregnant, like I have twice, you get this hormone rush and you just get like this hot, nasty feeling, and you're just like, if I could crawl in the freezer for 30 minutes, that would be great because I'm hot. And so the hormones, for anyone who takes hormones, whether it's in birth control or hormone replacement for menopause, hormones can lead to flushing. And the way that I found to get around it, at least when I experienced it with birth control pills, was to take it at night. So I took it at night, went to sleep. If my body felt weird, I didn't know it because I was asleep, and then it didn't matter because I woke up the next day and then it was all over. Because usually those side effects happen in the first little bit as your body's absorbing the medication, and so then once it spreads throughout the rest of your body, then you don't have that experience anymore. And then the third medication that can lead to flushing is usually IV contrast. I've talked on previous Periscopes, and some of the stories are on my podcast now. My husband doesn't have his gallbladder anymore, but when the gallbladder sent us to the emergency room and they were going to do a scan, he had to have IV contrast, and he was already on pain meds, but he kind of has this funny story of where the pain meds already kind of made him like loopy and he just didn't give a crap anymore. And so they're like, all right, we're going to take you and do this scan just to check at everything, look at his gallbladder, because that's what we suspected anyway when we went in. So they had to give him the contrast, and he said that he kind of felt it go in, and he felt it like whoosh all the way across his body. So like this, he felt the warmness of it like cross over his body. And some people freak out about that. He was on pain meds, so he kind of didn't care. I don't know what his fully conscious, intact brain would have thought about it, but some people kind of wig out about that just because it causes that sensation throughout your body. But that's pretty typical. And a lot of times with IV contrast, there's not a whole lot you can do ahead of time. The best option, if you ever have to get contrast, is to make sure that you drink lots and lots of water to flush out that medication from your body as fast as possible. So then the third thing I mentioned was the dryness. There's medications that lead to dry eye, that lead to dry mouth. Because they have this drying mechanism, they can lead to constipation. Cold medicines, because part of their job is to dry up all of the mucus and stuff that your body's producing because of the virus or allergies. They also cause drying of other things that have to produce liquids. So the lubrication that's produced in your eyes can get dried up from antihistamines or cold medicines. Your mouth, your saliva production can go down and lead to dry mouth because of antihistamines and other cold medicines. And then for people who take medication for overactive bladder, the goal of the overactive bladder medications is to slow down the secretions in the bladder so it doesn't feel like it has to pee all the time. So if it's drying up secretions there, then it's probably going to dry up secretions in other places. Again, in your eyes, in your mouth, and in your intestines, that can lead to constipation. Irritable bowel syndrome medications that work on, especially if the irritable bowel is more on the watery diarrhea side, then they help slow down the secretions in the intestines. If it's drying up secretions there, then it's going to dry up secretions in other places too. And so really the only thing you can do with those, especially you have to be on them long term, is to hydrate. How much do you hydrate? It's hard to say. You just have to hydrate until you feel hydrated, is usually because everybody's body is different. Another set of skin reactions that some people will go, oh, I'm allergic to that, I can't take that anymore, when it really wasn't a true allergy to that medication. It was just a side effect that they found intolerable. And sometimes we're able to help people get past the side effects, that they can tolerate the medication that the doctor wants them to take, especially, again, if it's something that you got to take long term. It's easier if you can get over that hump of those side effects, then the benefit on the other side is going to outweigh some of the suffering you have to do right at the beginning. If you can't tolerate it, then we always mark it down like this is not tolerated and we have to find another option to treat what you have to help you feel better. Y'all have a good day. Bye. Bye. Bye.
Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me @SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.